And our next speaker needs little introduction. Mr. Tomáš Pfeiffer is Vice Chairman of the Council for Integrative Medicine, philosopher, healer, and founder of the Institute for TCIM and CAM. He will introduce the Council for Integrative Medicine and outline its mission. Mr. Pfeiffer, the stage is yours.
Ladies and gentlemen, it's my great honor to have the opportunity to present you with the history of the Council on Integrative Medicine to the Health Minister of the Czech Republic. This history dates back to 1940s, when biotronics, a completely new branch, was created by Mr. Josef Zazulka. The method resulted in numerous successfully treated patients. And what is interesting is that in 1973, the president of the Academy of Science presented a declaration, a statement, in which he claims that Josef Zazulka is a very successful researcher and asks for creating new conditions of work for this person. At that time, the current ideology did not allow for such treatments in the realm of spirituality. For the chairman of science, it can't have been easy to publish such a document. Later on, one of the official trials in Vimperk Hospital was conducted, and this brought very important achievements, which sound like incredible miracles. Josef Zazulka revitalized a stomach tumor patient within a fortnight. When a person in terminal stage of cancer was completely revitalized. Colostomy duct, which had been created, healed itself without any surgery, and intestine connected itself and it returned to its normal function. And this is slightly related to Professor Špičák's topic. We can provide medical records related to all the research. Then many years passed, the Velvet Revolution came, and the conditions improved, and it became necessary to create support, also at a political level, and therefore a petition that brought 42,000 signatories and was discussed by the petition committee of the Chamber of Deputies of the Czech Parliament. The result of the hearing was very positive. It recommended inclusion of these alternative disciplines into medical practice and education at universities, as you can see on the slide behind me. And here we are getting to the outset of our council. Then later on, in cooperation with the members of Parliament of the Czech Republic, an activity leading to the creation of the Council for Integrative Medicine at the Health Ministry was formed, and it was part of the Committee for Postgraduate Education of Doctors. And that committee worked for numerous months. And here you can also see the presentation of petition for support of biotronics. And I'm pleased to inform you that at the moment, that working group has been transformed into a Council for Integrative Medicine at the Health Ministry. Most probably, we should also think about what this method and what this area can bring to healthcare and what its purposes and reasons are. Firstly, it's very important that EBM is well informed about what medical practitioners encounter on a daily basis, be it out of discrepancies when two different methods are being applied. But also because the curative outcomes of TCIM methods might be very successful. Here we can, for example, see the cost-saving effect of EBM and TCIM in Switzerland. And here we can see about a 20% decrease in costs. And our Institute for TCIM, we prepared a study on cost effectiveness, and it has led to similar results globally. This means that at present we have been able to see a great development of EBM, which is great, but naturally it has its consequences. These more perfect interventions have been also more expensive, and this is not financially sustainable anymore, unfortunately. How could this be useful? Our TCIM, if being applied in practice, can bring a greater benefit to EBM itself, because there will be more resources for increasing the quality of EBM treatments, thanks to these savings. Therefore, structuring verification of TCIM methods has to be conducted naturally, as you mentioned before, and there might be certain obstacles connected. I have worked as a practitioner of TCIM for 40 years. I experienced myself those difficulties to verify the outcomes of my treatments, to create studies. It's not easy to publish in an impact magazine. Although you have an article of the right format, it's not easy to get collaborators. Medical doctors often do collaborate, but non-officially, as they are afraid of using their credibility. They do not declare that collaboration publicly, openly. So this is the spirit of this era, and therefore also this Congress should contribute to the improvement and change of the spirit of this age, depending on how our heart feels it. Because if there is something which does help, that would be a great pity not to use it if it is really helpful. As for gaining evidence, this field can be also viewed from different perspectives. If I only apply statistics, then it very much depends how that given area is defined. If I seek for diamonds in the Czech Republic, I might filter millions of tons of soil and won't be able to find any single diamond. And I will be able to say that diamonds do not exist at all in the world, although a jeweler's at the corner offers them. So if we need to understand something, we really need to make effort. Otherwise, we would be in a position of those diamond seekers. So I've only touched this topic, which is much more profound. If we look at the activities related to research in Europe, here we can say that it's not that bad. Many research centers on TCIM have already started dealing with this topic. I have visited, for example, Charité in Berlin, the London Royal Hospital of Integrative Medicine in London, and I had an opportunity to meet Mr. John Hugh, the head of research there. So this is already ongoing in process. Here we can see what a skeptic might refuse as something irrelevant. But I believe that people are not stupid. People do use, or prevailingly, what they already have experience with, or what works. In developed countries, as the chart illustrates, you can see the representation of those who already use TCIM modalities. And that's really a very large number of patients who have the right of choice, and they have the right that these modalities gain the interest of research. I want to highlight that EBM must never be replaced by TCIM methods. All these methods should exist in parallel, and that's why we are using the motto, it's time to start cooperating, because despite all the achievements which have been made in EBM, we can still see an increase of incidence of non-chronic diseases, tumors, which have increased significantly, although mortality has dropped thanks to EBM treatments. There are also other treatments, also mental diseases like depression. We were presented with really large numbers of populations suffering of these problems, like the fourth one quarter of the population suffering of such problems. So these numbers already can demonstrate the situation very well. Here are some more lege artis methods, and that's the number of randomized control studies and PubMed databases for 10 most researched disciplines. The publication this resource comes from is alternative medicine in the world. At that time, when this book was published, more than 18,400 randomized control trials had been conducted by the date of publishing of this book. Acupuncture, herbal medicine, traditional Chinese medicine. I'm really looking forward to the time when I can see also biotronics on that list. These branches are not unknown in European and global hospitals. Let's start with Europe. And those little hearts show places where TCIM methods are being applied as complementary treatments in oncological interventions, reducing the side effects of chemotherapy and other conventional treatments. This is the result of a study published by one of the most prestigious medical databases, Cochrane, which compares the efficiency of conventional and complementary treatments. Potential positive effect is 37% in CAM and 44% for medicine in general. Probability of not having any effect of all is about 4.8%, and for medicine in general it's 1%. And potentially harmful might be only 0.69% of CAM medicines, while for medicine, conventional medicine, this is 7%. This is quite logical because conventional medicine uses more invasive treatments. These are often life-saving treatments at the same time. So this should be structured more in detail. If we are dealing with an injury or a loss of basic life function, then naturally a conventional treatment would be most relevant. However, in other situations, especially in chronic diseases, and as for insufficient transparency of the result, it was in 56% in CAM treatments and 47 or 48% for EBM medicine. So this is a very complex topic, and we could devote an entire lecture to it. And even EBM medicine is often bound in its own activities because of the research limitations. Here you can see the percentage of medical universities offering TCIM qualifications as part of their degrees. The larger number is in the USA. As it comes to the EU countries, it's about 42%, and newly accepted countries to the EU are only represented by 22%. And here you can see international institutions dealing with TCIM, be it the WHO and its WHA and other organizations all recommended the inclusion of TCIM and its research and the evaluation of its cost-saving benefits, leading to an integration of TCIM methods into healthcare. Here you can see some more international organizations whose findings were published. We could be surprised at seeing the NATO here, because more than 50% of the staff already use TCIM methods, and its study belongs to the best. Also, the resolution of the Parliamentarian Assembly of the European Council recommends a new approach towards non-conventional methods. And this is also related to what was the outcome of work of the Petition Committee of the Czech Parliament that recommended to take these steps. I believe that in 2 years' time we will be meeting here at our Congress, sharing new information and new progress made in our work. I wish you all success.
Mr. Pfeiffer, thank you so much for introducing the Council for Integrative Medicine and sharing your perspectives and experiences with us.